amid the ongoing scare of the virus spreading in China after 5 years of COVID-19. The first case of human metapneumovirus, HMPV, has been detected in India. Let's discuss about this virus and disease. Human metapneumovirus HMPV was discovered only in 2001, but probably has always been present in human populations. Infection occurs first in early childhood, and reinfections are common throughout life. This virus is similar in many respects to RSV. It belongs to the family Paramyxoviridae and is a member of the genus Pneumovirus. It's very common. In fact, research shows that most people are likely to have an infection at least once before age 5. You can be infected multiple times in your life. In children, human metapneumovirus makes up about 1 in 10 of all respiratory infections. Anyone can get HMPV, but some groups are more at risk. It causes both upper and lower respiratory disease. Now, who is at risk of human metapneumovirus infections? While anyone can get HMPV, those at higher risk are newborns, children under 5, people who are older than 65, people with asthma who use steroids, those with chronic obstructive pulmonary disease, COPD, those with a weakened immune system due to conditions like cancer or HIV, or who've had an organ transplant. Is human metapneumovirus contagious? Like any virus, human metapneumovirus is contagious, which means you can get it if you come in contact with someone who's been infected. It's also seasonal. This means you're more likely to get HMPV during winter or early spring months, around the same time as flu season. How does human metapneumovirus spread? The virus largely spreads when you come in close contact with an infected person. You might become exposed to the virus if you touch surfaces that contain the virus. Touch your mouth, nose, or eyes after you touch infected surfaces. Come in contact with droplets from an infected person through things like sneezing, spitting, or coughing. Have close contact such as handshakes and touching. Once human metapneumovirus enters your body, the incubation period, the time between exposure to the first signs of symptoms 2 to 8 days. Symptoms. Most HMPV symptoms are mild. They can include coughing, nasal congestion, runny nose, fever, sore throat, nausea, vomiting, diarrhea. How serious is human metapneumovirus? A small number of people can have more serious HMPV symptoms such as wheezing, asthma flare-ups, breathing difficulty, shortness of breath, fatigue, bronchitis, severe bronchiolitis, most common in children. This chest infection can be fatal in rare cases. And last is pneumonia. Let's come to the physical examination. The findings vary, but patients may have conjunctivitis, pharyngeal erythema, pharyngeal exudates, or pharyngeal cobblestoning. Depending on the phase of illness, the nasal mucosa may be pale, boggy, or red and swollen. Nasal mucus can range from watery to purulent. On auscultation, the lungs may be clear, or the patient may have diffuse wheezing or bronchial breath sounds consistent with a viral infection. Symptoms usually last 5 to 10 days, but often last up to 14 days. Let's talk about treatment part. For adults and older children, treatment of nonspecific URI is symptom-based. Fever, myalgias, and sore throat can be treated with acetaminophen, paracetamol, or a nonsteroidal anti-inflammatory drug, NSAID, such as ibuprofen. Rhinorrhea can be treated with ipratropium bromide. Nasal congestion can be managed with nasal decongestants such as oxymetazoline, 2 sprays into each nostril twice a day for up to 5 days, or systemic decongestants such as pseudoephedrine, products that combine a decongestant with analgesics, antihistamines, or both help relieve symptoms. Although supporting data are weak, cough may be relieved with dextromethorphan. For children less than 6 years old, cough and cold medicines should not be prescribed, recommended, or used because of the risks of adverse effects. Honey can help soothe a sore throat for children greater than 1 year old. Cool mist humidifiers may help with breathing, and saline nasal drops and bulb suctioning can help with nasal congestion. Patients need to be informed that symptoms generally peak early but can last for up to 14 days, that they are infectious as long as they have symptoms, and that they should rest and drink plenty of fluids to avoid dehydration. Red flags for which patients should seek care include a fever of greater than 102 degrees Fahrenheit, chest pain, other than from a pulled muscle, shortness of breath, dizziness, confusion, new ear or sinus pain, and symptoms lasting greater than 14 days. Although nonspecific URI can be complicated by otitis media and bacterial sinusitis, for an individual patient, an antibiotic is more likely to cause an adverse reaction than to prevent complications. Other remedies that are ineffective, of questionable benefit, or associated with significant adverse effects include echinacea, zinc, inhaled steam, vitamin C, vitamin D, garlic, antihistamines, Chinese medicinal herbs, intranasal glucocorticoids, saline nasal irrigation, and antiviral drugs.